Suicide contagion is where one suicide or suicidal act within a school, community, or geographic area increases the likelihood that others will attempt or complete suicide. Suicide contagion can be caused by the glamorizing and romanticizing of suicides by social media or the news. Anyone can be at risk, but those who are more likely to fall victim to suicide contagion are those who knew the victim, witnessed it, or saw the aftermath, those living an already stressful life, or those who contacted the suicide victim shortly before their death. Young people are far more likely to fall victim to suicide contagion than others. Suicide contagion is real, which is why I'm concerned about it, said Madeline Gold, a professor of epidemiology and psychiatry at Columbia University, who has studied suicide contagion extensively. Suicide contagion is seen in action when celebrities commit suicide. When Marilyn Monroe died in August 1962, with the cause listed as probable suicide, the nation reacted. In the months afterwards, the suicide rate in the United States jumped by 12% compared with the same months in the previous year. The case of Bridgend is also one of the biggest examples of suicide contagion. As of February 2012, there have been 80 known deaths since January 2007, all but one being hanging. Teens would commit suicide, and their friends in mourning would swear to not kill themselves. Later, those teens would kill themselves, and the cycle continues. The documentary Bridgend details the event. While there is no specific reason why suicide contagion occurs, there are some causes that can be inferred, especially in teens. Teenagers and young adults tend to be the most vulnerable to suicide contagion for 4 reasons. 1. They model the behavior of their peers. 2. They have a tendency to act impulsively due to their prefrontal cortex, where complex cognitive functions occur, not being fully developed yet. 3. Expansive media coverage in a day and age where teens live on their phones and social media, where the most romanticization of suicide can occur. And finally, 4. Due to development in stereotypes, teens who might exhibit signs of mental illness or a chance to commit suicide may go unnoticed or chalked up to just being a hormonal teenager. While there is no scientifically proven way to stop suicide contagion, there are methods that Bridgend has used and many others advocate. A decrease in media attention can help prevent suicide. Lowering the romanticization and surge of emotions portrayed in the media can remove the glamour and shock related to suicide. While suicide is an important issue, keeping suicides personal to the families will help decrease suicides after. Also, not portraying suicide as a release or an escape can lower suicides, and providing information for mental wellness centers and suicide prevention hotlines can do the same. In the 1994 death of Kurt Cobain of Nirvana, local coverage of his suicide was closely tied to messages about treatment for mental health and suicide prevention, along with a very public discussion of the pain his death caused his family. In the months after Cobain's deaths, calls to suicide prevention lines in the Seattle area surged, and suicides actually went down. Watch the following Dr. Phil clip to learn more about suicide contagion.
Real and legitimate concept. There are ethical guidelines for the media in how to cover that sort of thing, because the things that you typically see on the news, the memorials where people come and bring flowers and the heartfelt interviews and everyone talking about them, contribute to this copycat effect, because those that are trapped in a really bad place in their life and that maybe even remotely considering it, they look at that and say, wow, I would love for people to do that for me.
So what is the message to people who are obviously following this story, and there are people at home watching right now feeling depressed and thinking about maybe taking their own life?
There are so many patients that I've been called in to help with in the emergency room after a suicide attempt. And I can tell you that the vast, vast majority of those people will tell you it seemed like a good idea at the time, but they're so glad they failed. People that kill themselves believe that the world is better off without them. That is so untrue. It leaves carnage in its path. Don't do it. Ask for help.
While suicide contagion may have relevance to psychology, its amount of interest is not as important as the implications behind it. If you or someone you know is struggling with suicidal thoughts, please contact the National Suicide Prevention Lifeline at 1-800-273-TALK, which is open 24/7 to seek help. They are there to help with no judgment. Thank you very much.